నమస్తే వెల్కమ్ టు హలో డాక్టర్. ఈ రోజు హలో డాక్టర్ లో కేర్ హాస్పిటల్ విశాఖపట్నం నుంచి డాక్టర్ బిస్వాబసు దాస్, క్లినికల్ డైరెక్టర్, డిపార్ట్మెంట్ ఆఫ్ సర్జికల్ గ్యాస్ట్రోఎంట్రాలజీ అండ్ రోబోటిక్ సర్జరీ ఉన్నారు. సో డాక్టర్ తో మాట్లాడదాము. కరెంట్ డేస్ లో చూసుకుంటే చాలా మంది గ్యాస్ట్రిక్ క్యాన్సర్ తో బాధపడుతున్నారు. అసలు ఈ గ్యాస్ట్రిక్ క్యాన్సర్ ఎవరిలో ఎక్కువగా చూస్తూ ఉన్నారు, ఎందుకు వస్తుందంటే కారణాలు ఏంటి, వచ్చిన తర్వాత ఎటువంటి ట్రీట్మెంట్స్ అవైలబుల్గా ఉన్నాయి, అండ్ ఒకసారి వచ్చిన తర్వాత ట్రీట్మెంట్స్ తీసుకోవడం కంటే అసలు రాకుండా ఎలా అరికట్టచ్చు, రాకుండా ఎటువంటి జాగ్రత్తలు తీసుకోవాలి, సిమ్టమ్స్ ఏ విధంగా ఉంటాయి, వీటన్నిటి గురించి కూడా మనం డాక్టర్ అడిగి తెలుసుకుందాం. హలో డాక్టర్.
Hello ma'am, that's fine. Please go ahead.
Yes sir. So sir, my first question to you is like if we talk about the burden, how burden it is in India, sir?
Yeah, you see, gastric cancer is a very serious and dreaded disease, and it is quite common in India, especially in the south part of the India and in the northeast, probably because of their dietary habits. It is the seventh most common cancer in India, and it is the second most cancer in the men. And you know, every year more than 60 to 70,000 people are diagnosed with gastric cancer.
Oh.
This cancer is more commonly seen in older age group. In South India after 50, and in North maybe after 60.
Okay.
So the burden of gastric cancer is quite enormous, because getting cure of this disease is difficult if detected late. So it's quite serious.
Okay. And how can one diagnose that they are at the risk, sir? What are the risk factors, if we discuss about the risk factors?
You know, the risk factors are preventive. We can prevent. That's the most important thing. There is a small bacteria which is there in the like water, in the food, which contaminates. This is called Helicobacter pylori, H. pylori. So when you eat contaminated food, like you know, lettuce, cabbage, cauliflower, and you don't clean them properly, even fish and meat you eat, you don't clean them properly, then you don't, before eating or after eating, you don't wash your hands. This small etiquette, the H. pylori goes into our blood, stomach, and this is a very bad bacteria. It secretes one enzyme which destroys the acidity of the gastric mucosa. So what happens? It burrows into the wall of the gastric mucosa and stay there and cause chronic infection. And this leads in the long run to gastric cancer. This is the most common cause in Japan, where gastric cancer is very, very rampant, and in India also. So H. pylori infection, I strongly believe, is the single most risk factor which can be preventable by hand hygiene, cleaning things, and by taking medications. I will describe that later. Other than that, if you see one diet, like if your salt intake in your diet is more, or you eat food which is preserved with salts, like you see pickles you make at home, for keeping it for 6 months, 1 year, you add more salt to it. This salted smoked foods, like you see dry fish, they put more salt into that so that it stays for longer time. But
Okay.
when you eat, these salts injure the gastric mucosa and cause something called a chronic gastritis, which can lead to gastric cancer. So these are the two important things. Other than that, I believe alcohol, smoking, and red meat are the culprits. More than that, I strongly believe a familial history. Certain people, their family history is that they have more cancer because due to genetic alterations. These people, if have a family history, we can always look at it, prevent it, at least diagnose it early. So other than that, I strongly believe the old age, as I already tell, as you grow older, the chance of gastric cancer is more. To summarize, H. pylori infection, smoked food, alcohol, smoking, and red meat, and older age group and hereditary predispositions can cause gastric cancer.
ఓకే. సో గ్యాస్ట్రిక్ క్యాన్సర్ రావడానికి కారణాల రిస్క్ ఫ్యాక్టర్స్ గురించి డాక్టర్ చెప్తే విన్నాం కదా. ఇప్పుడు సిమ్టమ్స్ ఎలా ఉంటాయో తెలుసుకుందాం. సో డాక్టర్, వాట్ ఆర్ ద సిమ్టమ్స్ ఆఫ్ గ్యాస్ట్రిక్ క్యాన్సర్ డాక్టర్?
Usually, if detected early, it is good for the patients. But in the early stage, the gastric cancer will not show any symptoms.
Oh.
Maybe some people will have acid symptoms, reflux for long period of time, but they take medications. But suddenly, these patients, if they develop sudden weight loss, desire to eat is less, they have black motion in their stool, or there is an unexplained fall of hemoglobin, or they may be having a nausea and vomiting. Probably these are the symptoms which should prompt them to go to a doctor and get further investigation and tests to confirm is there any abnormality in the stomach.
Okay. So doctor, previously you mentioned that gastric cancer can inherit through the family history. So can one prevent getting gastric cancer? Sir, అంటే gastric cancer రాకుండా ప్రివెంట్ చేయగలుగుతామా?
Yeah, one can prevent gastric cancer definitely. As I told already, with H. pylori infection, more than 90% of gastric cancer can be prevented. This is a small bacteria which causes havoc. How to prevent? Clean your hand 20 seconds before eating, 20 seconds after eating. Clean your vegetables. Clean your utensils. Like you see, the small children that transmit this H. pylori more. So usually mothers, other relatives, they will catch hold of them. These physical contacts, also the saliva will secrete. So these can cause H. pylori infection. I strongly believe if we maintain a good hygiene, hand hygiene, drink clean water, then cooked food or not uncooked food, like you make a salad with vegetable, lettuce, you eat cherries, we don't clean them, you don't clean properly with water, you don't clean your hand, then what happens? It goes, the H. pylori goes into your stomach, and that stays silently and cause infection. So suppose you don't do this, still you get H. pylori, still you can prevent cancer. H. pylori can be prevented by taking 2 antibiotics and 1 acid tablets for 2 weeks. This can cure H. pylori, which in fact can prevent gastric cancer. So even if you get H. pylori, taking proper medical treatment can prevent cancer. Definitely, this is a very, very important thing. Then avoiding certain foods, like as I told, smoked foods, alcohol, avoiding smoking, avoiding red meat, taking more fruits and vegetables will probably decrease the chance of gastric cancer. And in case of someone is having a hereditary, as you told, that is a family history, regular checkup, doing at least an endoscopy every 2 years can prevent gastric cancer.
From the age of, sir? From which age they have
From
to?
the age of 50.
Okay. Yes. అండ్ డాక్టర్, అంటే ఎప్పుడు డాక్టర్ని కన్సల్ట్ చేయాలనే క్వశ్చన్కి వస్తే, డాక్టర్, వెన్ షుడ్ వన్ సీ ఎ డాక్టర్?
Like you see, as I already told, if somebody is having a acid symptom, dyspepsia, for at least more than 6 months and it is not responding to medicine, somebody is having acid symptoms with significant weight loss, loss of appetite, or vomiting, or blood vomiting, or black stool, definitely you should visit a doctor.
Okay. And doctor, what are the recent advancements in the gastric cancer treatment, sir?
You see, if detected early, gastric cancer can be cured. You can get cured of cancer. And the most important form of treatment for gastric cancer is removing the tumor. And the removal of the tumor is possible only by surgically going inside the tummy and removing the bad portion and joining the good portion. But there is a catch. Like when years back, what we used to do, we cut open the abdomen, go to the tumor, remove the tumor and adjacent tissues, and this usually used to be a big surgery. Patient needs to be in the hospital for long time. With the advent of laparoscopy and subsequent surgeries, what we are doing, we make small teeny holes with the help of instruments with precision. We go to the target organ like the stomach and the cancer and the lymph nodes around it without injuring any surrounding structure, without much blood loss. We removed every bit of the cancer tissue. There is a dye called ICC green. We can inject that into the tumor. So we know where are the tumor exactly into the body. So when you remove everything without cutting open with small teeny holes, and then you get a cure. The gastric cancer surgery has become much easier. The patient does not have much pain, they don't have a big scar, they go home early and they get cured more often. So instruments used in gastric cancer is definitely a breakthrough to give them a cure without much suffering.
Okay, so it means early detection is most important. So doctor, early detections ki ఎటువంటి టెస్ట్లు ఉన్నాయి? Are there any tests for early detection, sir?
Yeah, the only way, you see, there is no people are scientists are trying to find some test like by which by bloodstream we can detect that whether early gastric cancer can be detected or not, but there is no complete evidence on that. So the only way is if you have symptoms, I strongly believe like better to do go to a doctor and do a endoscopy.
Okay. And doctor, what are the various treatments available for gastric cancer, doctor?
You see, as I told, if it is in an early stage, the best form of treatment is surgery.
Okay.
And sometimes in very early stage, without surgery also, there is an endoscopic treatment. We do endoscopy in Japan, this is more common. Where you go, we remove the tumor tissue by endoscopic surgery. That is called endoscopic mucosal resection. To very early gastric cancer, endoscopic mucosal resection, and early gastric cancer and the cancers which are up to the stage 3 we can do by surgery, and that too by robotic means. And along with that, when in biopsy we found the lymph nodes are positive and it is going to little later stage, we can always add a before surgery or a after surgery chemotherapy. And there are a lot of good chemotherapeutic agents which are having less side effects, but they can, give the patient a better chance for cure and less chance of the tumor coming again. So the good surgery, adding proper chemotherapy if required, immunotherapy if required, can, and regular surveillance even after surgery probably can give them a cure and a new life.
ఓకే. అండ్ మనం వేరే క్యాన్సర్స్ చూస్తే ఆ క్యాన్సర్స్లో డిఫరెంట్ స్టేజెస్ చూస్తూ ఉంటాము. అలా చూస్తే గ్యాస్ట్రిక్ క్యాన్సర్ ఏమైనా స్టేజెస్ ఉన్నాయో తెలుసుకుందాం. సో డాక్టర్, ఆర్ దేర్ ఎనీ స్టేజెస్ ఇన్ ద గ్యాస్ట్రిక్ క్యాన్సర్? వి సీ డిఫరెంట్ స్టేజెస్ ఇన్ డిఫరెంట్ క్యాన్సర్స్, రైట్?
You see, in a common man's term, I can tell the stages of cancer is like when the cancer is only inside the gastric mucosa, that is a grade 1 or a stage 1 cancer. As it spreads into the muscle, it is a stage 2 cancer. It is going beyond the gastric wall, just touching that is a stage 3. If it goes beyond the gastric wall and touches adjacent organ like liver, pancreas, it is a stage 4, it is a T4 cancer. Again, there are surrounding lymph nodes around it. So the lymph nodes are negative, it is a early gastric cancer. If the lymph nodes are positive, it goes towards a stage 3 or a stage 4 gastric cancer. Sometimes we get patients, those who are in a very late stage, like there will be a stomach cancer. Along with that, there will be multiple tumors in the liver. There will be a lot of water inside the tummy, which is called ascites with peritoneal deposits. Those cases are late, and in those cases, even if you try with the best of the best medications, nothing will happen. So we want that people should be more aware of gastric cancer, and if they have symptoms like a bloating, dyspepsia for a long period of time, not responding to medicines, they don't have a desire to eat, and they have a significant weight loss or have a black stool or a unexplained anemia, they must visit a doctor. Then probably if we detect it early, then the tumor or the cancer can be cured.
ఓకే. అండ్ ఇప్పుడు సర్జరీ జరిగేటప్పుడు అండ్ సర్జరీ జరిగిన తర్వాత పేషెంట్ సైడ్ కాంట్రిబ్యూషన్ ఎలా ఉండాలి తెలుసుకుందాం డాక్టర్ని అడిగి. అండ్ డాక్టర్, ఇఫ్ వి టాక్ అబౌట్ దట్ పేషెంట్ సైడ్ కాంట్రిబ్యూషన్ డ్యూరింగ్ ద సర్జరీ అండ్ ఆఫ్టర్ ద సర్జరీ.
Before surgery, they should stop smoking, and they should eat good protein fruits, so that those post surgery results will be good. During surgery, they should choose the right doctor, and they should go to a center of excellence. They should choose the best method of surgery. Like as of now, I feel laparoscopic or robotic. And post surgery is very very important. They should eat good nutritious high protein diet, and they should be in a regular follow up with the doctor, so that there is, if there is a early recurrence or if there is any complications related to surgery, that can be prevented.
Okay. And doctor, once the gastric cancer cure, again, is there any chance to reoccur, sir?
I'll tell you, there are multiple stories. One of my friend, who is a big owner of a software company in US, he was like 49-year old when he get gastric cancer,
Okay.
and he was operated by me, and almost uh, 8-10 years is over. Don't have any cancer anymore. He is almost cured. Usually, we consider after 2 years, if the gastric cancer does not come again, it will not come. So, detected early, treated well, definitely. We have a lot of patients who are cured. They forget that they have cancer, and they are common. They are like normal human beings. So that is the best part of science.
Okay. And doctor, if we see these days, as of me, everyone are educated and they're all searching in the Google, they're taking the self medication, right? So in that way, they're prolonging the disease, prolonging the gastric cancer. So in that way, so what are the complications they're going to get, sir?
You see, I'll give you a example. Even if I have a lesion or a skin disease or some problem, then I search myself in the Google. Google is so confusing. So it is better not to go by the Google. Better to Google a good doctor and meet him and or meet her and take your opinion. Because you see, suppose I feel like I am having acidity, and I keep taking the medicines. I may not have acidity. I might have a heart attack. I might have a MI. So if you take acidity tablet and you don't go to a cardiologist, you might die instantly. Similarly, in regards to gastric cancer, if you neglect it, it will be in a late stage where you come to the hospital. So many people, those who are poor, they're in remote villages, they don't complain even to their relatives that we are having a vomiting, weight loss, blood motion, or anything. So what happens? In a when the situation is very bad, they have a tummy which is full with ascites, they have jaundice, their liver is not functioning, the stomach tumor has spreaded everywhere. That time, even if the relatives spend everything, then they can't get back their own people. So my opinion, like everyone, if they have any symptoms, they should go to a nearby doctor and ask them and do the proper test and get it detected early. Little inhibition can do a havoc to one's life. So better not to be inhibited, better to open up, better to share with someone nearby, better to share with a doctor and get treated early. That way the life can be saved and can be prolonged.
Okay. And doctor, after the surgery, how frequently patient should go for a consultation or follow scans or checkups, sir?
Usually, in the first year post surgery, I call them every 3 months, initially after the removal of the sutures.
Okay.
And in between, if the patient needs chemotherapy, they need to go to a medical oncology or like the doctor who gives medicines for the cancer, so that the chance of recurrence is less. After 1 year, I call them every 6 months, and after 3 years, every 1 year.
Okay. And doctor, there are a few doubts or myths we can say, sir. See, after the surgery, the patient should not move. They have to take a rest continuously, kind of. So, are they really necessary, sir?
You see, it depends on what type of surgery we do. With the invent of advanced robotic equipments, the way the people live, we do surgery as if a surgery has not been done. On post-operative day 2 or day 3, they walk around, they start eating, and they go home on day 5. And after that, they are like any other normal people. They eat, they walk, they travel, they go by car, go by train, and they eat almost normal food, where avoiding certain foods like a spicy non-vegetarian food or similar things, but they could have almost a normal life. So let us take in 7 to 10 days time, they are almost normal to their own relatives. They can eat, they can live normal life. To summarize, gastric cancer is a dreaded disease in India, and this can be preventable by taking clean water, by being more hygienic, avoiding H. pylori infections, avoiding alcohol, smoking, red meat, and smoked salted food. And if detected early, it can be curative with the help of modern robotic surgeries, and the patient can be cured and lead a normal life. So I strongly advise, if you have any symptoms related to gastric cancer like significant weight loss, loss of appetite, dyspepsia, or black stool, or blood vomiting, or vomiting in general, then please go to a qualified doctor, get a test done like an endoscopy and a CT scan, and if the cancer is detected early, please get the surgery done, and if required, add the chemotherapy as required and lead a normal life. We have so many patients, those who are almost cured, they are the warriors, they lead almost a normal life, forgetting that they have a dreaded disease like gastric cancer. So be aware and go to the doctor if you have symptoms early. Thank you.
Yes. Thank you, doctor. Thank you so much for giving us valuable information, and thank you so much for your precious time, sir. Thank you.
Thank you, ma'am.
Thank you, sir. సో చూసారు కదా, డాక్టర్ చెప్పినట్లు గ్యాస్ట్రిక్ క్యాన్సర్ రాకుండా మనం జాగ్రత్తలు తీసుకోవాలి, ఖచ్చితంగా హైజీన్గా ఉండాలి. సో ప్రతిదీ మనం ఏ ఫుడ్ తీసుకుంటున్నా సరే బండే ముందు కూడా, అంటే కుక్ చేసే ముందు కూడా 1-2 సార్లు శుభ్రంగా వాష్ చేసుకొని, ఈవెన్ మన హ్యాండ్స్ని కూడా వాష్ చేసుకొని ప్రతిదీ కూడా కేర్ఫుల్గా చెక్ చేసుకొని తినాలని చెప్తున్నారు. అండ్ క్యాలీఫ్లవర్, క్యాబేజ్ ఎక్కువగా తింటూ ఉన్న వాళ్ళైతే ఇంకొంచెం ఎక్కువ జాగ్రత్తగా ఉంటే బెటర్ అని డాక్టర్ చెప్తున్నారు. సో వచ్చిన తర్వాత మనం మెడిసిన్స్ తీసుకోవడం, సర్జరీస్కి వెళ్ళడం కంటే రాకుండా మనల్ని మనం కాపాడుకోవడమే మంచిది. సో దట్స్ ఆల్ ఫర్ నౌ. స్టే ట్యూన్డ్.